We have a major meeting coming up in India in the month of April. This meeting is called Acos, which stands for Asian Clinical Oncology Society's meeting. This is a meeting that everyone should attend, whether you are in Asia or you are not in Asia. The reason is we know something, that cancer is going to be a major issue in developing countries. Developing countries have transited their epidemiology, and now we are seeing that cancers are growing. In fact, on today's date, 60% of all cancers are in developing countries. Of these 60%, 40% are in Asia. 40% are covered mainly, of these 40%, 35% is covered in India and China. The two giants which are actually trying to create the world's population base are the areas of most common cancers that we are seeing in the world now. And the second part is 70% of all deaths in cancer are in developing countries. And these are going to be dominant out here. The cancers are also different because in these areas we realize there's a cancer which is related to infections, which we don't talk in the Western world. So people who are from advanced countries should come in and check it out. People who are from developing countries and from Asia should come and see what we have as major issues and where we can take to see that developed medical cutting edge treatment and investigations can be applied to a situation of emerging countries, countries where we have poverty, and give a effective, accessible, affordable and available cancer care, which can be put in a good team disciplinary sessions. We have sessions that will actually improve out our understanding of cancers, the specific emphasis on this region. For example, I can give you an idea that China sees a lot of cancers which are nasopharyngeal cancers. We have parts in India which sees nasopharyngeal cancers. We have Singapore, a pocket area of nasopharyngeal cancers, and our colleagues in the Western world don't see too much of it. Similarly, we have gallbladder cancer, which is so common in the Gangetic belt of India. And in some parts of China, basically on the banks of the river Yangtze, where you can see quite a few of those patients. Now, having looked at the whole issue in that manner, it's time that we exchange notes, because the world is a global village. You cannot allow a part to develop and you cannot allow a part not to develop. You have to develop as a whole. So collaboration between the two worlds become very, very important. We have speakers who are coming in from Europe. We have speakers who are coming in from USA. We have speakers who are coming in from Korea, Japan, and we have speakers who are coming in from the developing countries. All of them will be discussing issues which are relevant in their situations and how we adapt the knowledge to us and to us alone to see where we take it forward from here. So I think everyone should be here